So today we're going to be talking about Salmonella. And Salmonella is an infection causing gastroenteritis, stomach upset. You know what you should know, we're coming up on holidays here where it could be an impact. And a lot of times we get an upset stomach, inflammation in our bowel system, gastroenteritis. And we don't really know what causes it. And, perhaps some of you aren't familiar with some of the ways that Salmonella infection is passed along. So this is not medical diagnosis or medical suggestions, but just a group discussion amongst friends about this particular topic, something we do weekly on the grand rounds of the year here for the Medical Amateur Radio Council. At times you may hear individuals on the Zoom session that are coming in through shortwave radio. And if you do hear that, it sounds a little different. That will explain that. We'll be having questions and input and follow-up through the net control, which is me, AA4 FL at the mic. So we do have two websites. We do have one for the public, marco-ltd.org, and we have a members-only site. It's a password-protected site, healthcarehams.org. I hope you'll check us out. So Salmonellosis, or bacterial infection from Salmonella bacteria, it's a common bacterial disease that affects the intestinal tract. And if you look online at the Mayo Clinic and search for Salmonellosis or just Salmonella infection for the Mayo Clinic, their websites will give you some excellent explanations, as well as many other reputable sites that you might choose to gather information from. They typically live, Salmonella bacteria, in animal and human intestines, and they're shed through stools, feces. So humans become infected most frequently through contaminated food or water. Now, some of us with Salmonella infection have no symptoms, but most people that do develop diarrhea, fever, and stomach or abdominal cramps within 8 to 72 hours after exposure. And most healthy people recover in a few days to a week without specific treatment. And we'll talk some about the venues for the disease, where you actually get it from, how we can prevent it. You might seem trite, but I tell you, as a health professional, as a dentist, when I was a student, I didn't know how to properly prepare some foods, and I'm sure I had infection from Salmonella lightly, but if it can happen to me as somebody that has a health training and knows better now, hopefully we'll be able to enlighten others to that today. So in some cases, the diarrhea can cause severe dehydration and requires prompt medical attention. So those of you that are aware of dehydration, have a medical background, know how severe that can be and the problems that it can cause further down the line in the body. So life-threatening complications can develop if the infection also spreads beyond the intestines or the dehydration becomes severe. And the risk of getting the Salmonella infection is higher when you're traveling to countries without clean water and proper sewage disposal. Salmonella infection is usually caused by eating raw or undercooked meat, poultry, and eggs or egg products, or by drinking unpasteurized milk. And the incubation period, the time between exposure and illness, can be 6 hours to 6 days. And often people just think they have the stomach flu. And that's, now you're aware of the potential issues. And as we talk about this today as a group, and we discuss from hearing from different individuals that are checking into the net, I think you'll be much better off for the discussion. This is Whiskey Bravo 5 Delta Medical Amateur Radio Council, grand rounds on the internet, talking about Salmonellosis today. And this is a group discussion of people with common interests about medical topics that happen to be ham radio operators. And that doesn't mean you're a health professional, anyone in the amateur community. If you have any questions now, at this time, early or late check-ins, go ahead and make the call to me, Whiskey Bravo 5 Delta, AA4 FL at the mic, and net control. Taking calls now. Okay, another patient there. Okay, now
Okay, I need you to mute your mic, Dave.
November for TSC. Got you checked in here by way of the relays. Thank you for being here, Jerry, with us. Any other further check-ins or questions?
We have Delta.
Whiskey 8, Juliet Delta Papa. Thank you for checking in, Joel. Any questions?
Negative, sir.
Okay, thank you, Joel, and thank you for being here with us. And of course, just follow up with me at the QRZ information at AA4FL. Now, getting back to the program here again for the general public, the signs and symptoms of salmonella infection generally last us, a few days to a week, and that diarrhea may last for up to 10 days, but it could take several months before the bowels return to the usual stool habits. And a few varieties of Salmonella bacteria can result in typhoid fever, which is obviously much more serious because that's sometimes deadly disease that is more common in developing countries. And most people don't need to seek medical attention for salmonella infection because it clears up on its own with a few days. And this information you can find online. This particular text comes from a Mayo Clinic website, and there's lots of reputable sources out there, university-based sources and university-based health centers. So salmonellosis symptoms of diarrhea, stomach cramps, fever, nausea, vomiting, chills, headache, blood in the stool. And as I said before, I had experienced them before and made that connection because of the fact of what I was preparing for food, that we will discuss. And we've talked to medical doctors today, and as we go here, members of our group, we're going to get some input from them on what they've experienced in their own patient pools, and making that connection for patients to the symptoms. We have the causes mentioned before of infected food and water, and more likely to happen when you're traveling, because in raw meat, poultry, and seafood, feces may get into it during the butchering process, and seafood can be contaminated if harvested from contaminated water. So raw or undercooked eggs are also a potential source because while an eggshell may seem to be a perfect barrier for contamination, some infected chickens produce eggs that already contain salmonella before the shell is even formed. So raw eggs are used in homemade versions of foods such as mayonnaise and hollandaise sauce. And of course, if you saw the movie Rocky, it's preparing in training to see drinking drinks with raw eggs. So occasionally there are dishes that are made or for medical purposes, for health purposes, people consume raw eggs, but be cautious. Unpasteurized dairy products can also be a source. Raw milk could be contaminated with salmonella. The pasteurization process itself kills harmful bacteria, particularly including salmonella. So as other sources, what about fruits and vegetables? And what about imported varieties that may be irrigated in fields or washed during processing with water that might be contaminated with salmonella? It could also occur in the kitchen because of juices from raw meat and poultry come in contact with uncooked foods, such as salads. What about a countertop when you're preparing food? Many of us can prepare poultry, which we're going to talk about sources and causes, and other foods can become contaminated at the countertop, or if you did not wash your hands thoroughly. So infected surfaces and improperly handled food are also sources. What about pets and other animals? Especially birds and reptiles, they may carry salmonella bacteria on their feathers, skin, or in their feces. And some pet foods themselves may be contaminated and can infect animals. And there's a link that you can find on the National Institute of Health that talks about these particular topics. You might look for one that's a review of public health challenges of salmonella in turtles, because reptiles are a group of animals that are subject to having salmonella. And there's also infections linked to poultry. And if you look at one related to raw turkey products, and you look at Google for multi-state outbreaks of salmonella infections, you'll be able to find that article. If you have any questions, you can email me through the information that we're providing here for a link. Just look up the healthcarehands.org for information about contacting us. So I'm going to pause one here. Do we have up till right now, before we start talking about how to properly thaw a turkey in preparation for Thanksgiving, do we have any other input, questions, or comments or late check-ins at this time? Make your call to AA for us. Okay, is it WA1EXA? Is that correct? Okay, I have you checked in, and I'm also got W1HMM checked in as well. Thank you to both of you. This is Whiskey Bravo 5 Delta for ID, the Medical Amateur Radio Council, having a discussion in net format on salmonellosis today. All amateurs are welcome to participate. You do not have to be a member of the Medical Amateur Radio Council. You all have an interest in the subject material. It's something we deal with and within our families. Hopefully not the disease itself, but for those of you that might be prone or not aware of the symptoms, again, this is not medical advice, but it certainly will enlighten you to be on the lookout. Do we have any other further questions or comments? And we're going to continue on with the discussion. We'll pause periodically to create lists and get input. But as we prepare for the holidays here, this is what got me into trouble. And this is why I was in dental school, is properly thawing a turkey, because they need to be kept at a safe temperature during the big thaw. And you can thaw it in the refrigerator. It's safe indefinitely to the thawing, however, but when it starts, before it's frozen. But when it begins to thaw, any bacteria that may have been present before freezing can begin to grow again. And immediately after the grocery store checkout, make sure you put it store it in the freezer. Don't leave them on a back porch or car truck or basement or anything else where the temperatures cannot be constantly monitored, because we know that if we have a freezer in the right location, it's serving its purpose of keeping it frozen. And if it's left on the counter for more than 2 hours, it's not safe temperature. Even though the center of the package may still be frozen, the outer layer of the food is in the danger zone between 40 and 140 degrees Fahrenheit air temperature, where foodborne bacteria multiply rapidly. And this is information that you can Google it online. It's through the government there. This is a government website. I think we may have some input here momentarily, but there are 3 safe ways to thaw: the refrigerator, cold water, and the microwave oven. And we'll talk about the details of that momentarily. N5RTF, Chip, did you have some input that you'd like to offer at this time?
Well, I recall when I was a general practitioner, I worked in a rural area that had a lot of poultry processing plants. Can you hear me well?
Go ahead and repeat, please.
Okay. When I was a general practitioner, I worked in a rural area that had poultry processing plants. And it was understood when they hired a new employee that they were going to be sick at some point during the first month, but then they were rarely sick after that. I can also say that I've had pet turtles almost all my life. My oldest one right now, Tortoise, is 26 years old. I also have some pet ducks. So I consider myself pretty immune to Salmonella. I haven't had an infection in many, many years, but it could happen again.
Thank you for the input. Chip, hang on a minute. I have another question for you. So Chip is a psychiatrist, a retired psychiatrist that did work as a general practitioner for a while. Chip, what are your thoughts on the evolutionary biology or man's ability or animals' ability and the risks of getting different infectious diseases and having morbidity or even mortality from them? Go ahead.
Well, in nature, of course, every animal has to find something to eat, but they also have to avoid being eaten. And enteric bacteria are just one more tool that animals have, like teeth, claws, stingers, gut bacteria are poisonous to other species. Reptiles and birds carry salmonella. We carry E. coli. Most of the time, animals from one group will not eat the other one because the gut bacteria are toxic. Some animals are very careful and eat around the gut. This allows animals like vultures and things like that to eat decayed meat. But they do pick very carefully around gut bacteria. And it's just a part of nature that we forget about because we have fire and just the ability to cook foods opened up a pathway to allow human beings to eat almost anything without getting sick. Without that, it's a question of whether our species would even have survived. This is N5RTF.
Thank you, Chip, N5RTF. This is Whiskey Bravo 5 Delta AA4FL net control at the mic. And we do appreciate all those that are going to make comments today. Many of our members and guests here on the 20 meter net will be having input. I see WJ8B, I'm not sure that he's still here. Andy, you are. Andy, did you have, you were someone that was a medical practitioner and dealt with a lot of emergencies. Could you give some feedback or input to cases that you might have seen and how you might have got to the conclusion that Salmonella could have been a source? You go ahead and do so. I'd appreciate your comments.
Okay, well, when I practiced in Circleville, Ohio, which is a small city about 25, 30 miles south of Columbus, three times we had outbreaks of Salmonella from a large church group or, where people were preparing food that was not from a restaurant. And, there as many as 3, 4, 5 people will get sick from that. Had one family, it was interesting that almost the entire family, except for the mom, got diarrhea, and it turned out what it was turtles. The kids have bought turtles, when they were in Florida and brought them back, and they eventually got Salmonella from that. We also had a few cases of Shigella. Not too many of those, but the people with those, the diarrhea was way worse than it was with the Salmonella patients. So, but it's out there, and you have to take the proper precautions and avoid pets that carry this stuff. If you at least try to keep them outside or in a cage where you're not going to have hand contact with, where you might not, be able to wash your hands. So.
Okay, this is Whiskey Bravo 5 Delta. That was Whiskey Juliet 8 Bravo. Andy, in the Columbus area. It's interesting in having this discussion, Andy, you brought something to mind that's turtle related. One of my employees was from Wapakoneta, not too far from Columbus. And the church socials there years ago, it was turtle soup. Nowadays, for environmental reasons and species reasons, it's mock turtle soup. But that seemed to be a custom up in Ohio. WJB Whiskey Bravo 5 Delta.
Yeah, I've not heard of, at least in my experience, I didn't take care of anybody that got it from turtle soup, as to my knowledge. But of course, that easily could have happened. Wapakoneta's way west of here. It's pretty close to the Ohio-Indiana border. But it's when we figured on the family that probably the young children basically had hand-to-mouth contamination from handling the turtles. And, I probably just didn't have the knowledge or to know that they had to wash their hands carefully after handling them.
Okay, thank you. And that's a good point. So if there was contamination, it would have been from handling the turtles as they were preparing the soup, because once it's heated, they would have I assume not had the contamination.
Right.
Since, like we talked about with non-pasteurized fresh foods. Are there any others here that would like to make a comment? I'll make a list here. I'll pause for a second, take that list either on the air or here through the Zoom feed that'd like to talk about their situations where they've had patients or friends that have gotten salmonella infection. Okay, the W8 station, uh, make your call again to me, please. W8JPB, I believe, is that correct?
We have Delta.
W8 Juliet Delta Pop. I'm sorry, I got it now. You've already checked. And go ahead and take the mic here. Well, I wasn't aware of that. Thank you for mentioning that. So, reptiles in general. Go ahead. Oh, thank you for that input. We do appreciate that. Again, we have a wealth of individuals who are members and have backgrounds in health-related fields, and we all experience the world in slightly different ways, like Joel just explained, WHJDP. And it's nice to have a consensus. We certainly have a look through different sets of eyes as we talk about these subjects. And, thank you. It's one of the values of the Medical Amateur Radio Council. We're going to talk a little bit about Salmonellosis and some of the epidemiological and pathogenesis, some of the more scientific sides. And you'll be able to find the article online. If you need to Google that article, it's an overview of the epidemiology, pathogenesis, and innovative approaches to mitigate the antibacterial resistant infections. So in this particular case, we're moving to a little more, just introduce the science. I'm not going to get into the full details because you can read the article. But knowing that it's a food-borne pathogen and a leading cause of gastroenteritis in humans and animals, it is also highly pathogenic. And it belongs to a family, let me not mutilate this, Enterobacteria case. I'm sure I did not get that pronounced correctly. I apologize for that. Why antibiotics constitute the primary treatment, the emergence of antibiotic resistance, unfortunately, is occurring. And that rise of multi-drug resistant Salmonella strains has highlighted the urgency of developing antibiotic alternatives. And this particular article that you can Google is from 2024, so it's recent, and it's a big overview. An effective infection management necessitates a comprehensive understanding of the pathogen's epidemiology and transmission dynamics. So we have holidays coming up where this is very pertinent information. As Joel just mentioned with the bearded dragons, if you're going to give a Christmas gift to someone, make sure if you give them a bearded dragon or some other reptile, that you also explain that they need to wash their hands afterwards. And obviously with Thanksgiving coming up, we're all turkeys eating turkeys. So this is covered online and in print through that comprehensive review. Focuses on the epidemiology, sources of infections, risk factors, the transmission dynamics, and the host range of the serotypes of Salmonella. The severity of the infection in humans varies depending upon the serotype or the type of the bacteria, the variant of it for those in the general community, and the immune status of the person that's exposed, the host, with the infection classified into typhoidal or non-typhoidal types. The non-typhoidal salmonella infections are often associated with the acute onset of diarrhea, abdominal cramps, and fever, but it's usually self-limiting, as we talked about earlier in our discussions, resolving between 1 and 7 days without treatment, depending upon the host status. So, and this is the Medical Amateur Radio Council Grand Rounds of the Year, net for ID, Whiskey Bravo 5 Delta, AA4FLJ here in Hawthorne, Florida. It's serving as net control and sort of your moderator of the discussion for those that are seeing us or hearing us in different modalities other than shortwave radio. So, however, about 5% of people, including immune compromised patients, infants, and older adults, may develop bacteremia or bacteria through the bloodstream or invasive infections such as meningitis, osteomyelitis, endovascular infections, and septic arthritis. And previously we discussed about this, that bacteria, they get beyond the gut, that enter into the body, and what the threat they can be. But the typhoidal salmonella variants are responsible for non-specific disseminated infections with symptoms including a sustained fever, headache, diarrhea, constipation, loss of appetite, and relative bradycardia. So we can start to have heart rhythm effects as well. And this is information that's available on this study or this overview that's available. It's also in the Journal of Antibiotics in January of 24. Just look for the overview of innovative approaches to mitigate antibacterial resistant infections. So the pathogenesis or disease-causing ability of the Salmonella starts with the adherence of the bacteria to the cell surface of your gut, the host. You as the infected individual. And after the adhesion, the bacteria's internalization that can occur either through the uptake of bacteria or through active invasion through cells. And the process involved, I'm not going to get too much into the science here and all the words and the verbiage. We're going to talk about it for the general public here on amateur radio. That relies on the engagement of multiple receptors. There's actually pattern recognition receptors where we can bind to. And that includes all types of receptors. It has components of the cells that contribute to that. Again, we're not going to get into the full science here because you can read that in this very extensive article. But the treatment typically relies on supportive therapy, and it's normally self-limiting, and the individuals do not require therapeutic treatment. However, individuals with weakened immune systems, underlying health conditions, or severe infection might require antibiotics. So in the past, there were certain medications that were used that even are not preferred now. There's preferred choices like ampicillin, third generations quinolones like ciprofloxacin and levofloxacin, and third generation cephalosporins as well, macrolides. Unfortunately, the bacterial resistance to the important antibiotics has been growing, posing a challenge to effective treatment. And that's true for a lot of infections. We live in a world where this rapidly occurs, in part due to overuse of antibiotics. And the more often something's used, the bacteria develops ways to avoid it. That's their survival. So antibiotic resistance is a global concern for both these strains, the typhoidal and non-typhoidal. And the emergence antibiotic resistance is escalating trend of 20 to 30% per decade. And the extent of the resistance can vary across different antibiotics and different variants or serotypes of the bacteria, because it's highlighting that delicate interplay between the microbial genetic factors, environmental conditions, and the selective pressures that contribute to the diverse spectrum of strains observed within the general population. In 1 minute, I'm going to have Whiskey Bravo 9 Alpha Echo Delta Papa and have a minute or two to just briefly introduce the science behind it, just the science of what's going on with infectious disease, and summarize that in a minute or two. But Harry, before I give you the mic, is there anybody else that would like to make a contribution, make a call to Whiskey Bravo Delta? Okay, Whiskey Bravo 5 Alpha Echo Delta Papa, are you here to have a minute or two discussion? Harry, go ahead. not capping Harry. Harry must have stepped aside for a few minutes. But when antibiotic resistance occurs during commonly used antibiotic treatment, there are many strategies to address the issue. And the article outlines them in detail because it's not what you would think, because it varies from addressing the source to treating those infected, and it also varies from traditional to non-traditional methods. So it's well worth the read. Well worth the read in this journal, Antibiotics. And again, it's January 2024, and I hope you'll get a chance to investigate that. So here from the Medical Amateur Radio Council, grand rounds of the year, having a discussion on salmonella infection, which is very pertinent to this time of the year leading up to the holidays. Let's have some discussion from the members of the general amateur community. Let's start with personal infections, like I mentioned, that you may have had. Is there anyone here, either on Zoom or directly on 20-meter shortwave, that's had experience with a personal infection? If you'd like to talk about it, make your call. We'll make a list here. The Whiskey Bravo 5 Delta.
90 p.m. back in the saddle, Jay.
Okay, well, we're going to just go ahead and pause one for you, Harry. Just a minute or two. We had talked about antibiotic resistance, and somebody that has scientific background with infectious diseases, not to dwell on your personal accolades here, because I know you're very experienced, but you can just talk a little bit of the science behind that and why that occurs. WB9 EDP, Whiskey Bravo 5 Delta, go ahead and take the mic.
WB5D and the mark on that WB9 Echo Delta Papa. I think you focused a lot of the subject. The biggest issue is supportive care. And when people come in, generally they'll see their internist or family practice doctor. And the one thing that we worry about is dehydration, and that generally is from diarrhea. What is, without getting into the deep science of this, is that Salmonella can present within as little as 6 hours and then be mistaken as food poisoning. So that's a questionable issue. Or as late as 6 days post-exposure. And you can do everything you can, let's say it's clean and sterile as can be, but someone that's preparing the food or picking food or someone in any kind of service that may have not done everything to standard, but say, push their hands, and believe it or not, that is a pathway to you rendering yourself with salmonella. Having dealt with at one time close to 115 cases within a 24-hour period because of covering a very large jail population, we looked for outbreaks that really required a lot of scrupulous care and cleaning the kitchens and things like that. So that type of preventive. But when the antibiotic is a last resort, so we hope we could use it as a last resort. But I think what's very important is anyone that has had an autoimmune disease or has a transplant issue or something that would affect the immune system, or you are on, and many people don't think of it, a proton, let's say let's say something, an H2 blocker for heartburn. We'll keep it very simple. And that reduces the immune system in that cardiac muscle in the gut lining of the stomach and small intestine, which gives a segue for salmonellosis to spread. So there's a lot of practice going on and working on, of course, working on different ways of antibiotics that are not prone to being resistant to salmonella. But right now, supportive care is number one. Most people, it'll burn itself out. They'll do just fine. But not to belabor that or go into too much science, if I could address that per your request, Jay. WB5D, WB9, Echo Delta Papa.
Okay, Whiskey Bravo 9 Echo Delta Papa, Whiskey Bravo 5 Delta AA4FL net control the mic. Harry, thank you very much for that input. And actually, you made an extremely important point that was not brought up. We talked about the host. but we do know we do have compromised hosts. And many of us in the age of the amateur community, and those here on 20-meter tend to be hams for many, many. And many of us are on medications that have side effects. We have medical problems that have side effects from our own infections that otherwise individuals would not get. So that is an extremely important point. Thank you for that contribution. Mentioning the jail population, we're looking at outbreaks. That's where all these science gets researched. They form the foundation of investigations. And I think this article that we referenced will probably, as you read on, will encompass that as references. Andy, WJB, did you have something more that you wanted to contribute at this point? Go ahead if you do.
Okay, well, not too much. When you talk about compromised hosts, that would also include people who are undergoing chemotherapy and or radiation treatments for malignancies, because they're obviously a reduced immune system, or anybody who's had a prior one, that especially those that had it involving the blood system, someone's had a prior lymphoma or leukemia. Those chemotherapies have long-lasting effects on one's immune system. Of course, anybody with HIV can be affected by it as well. So.
And thank you very much for that contribution. As you can see here, for those of you that are listening or watching, that we have a quite extensive membership that has expertise in many areas, whether it be in the science or the medical practice. And of course, all of you have family members, so you have experience through your families in the practical side of things. So is there anybody that's had a personal infection that would like to talk about? Make your forward that to me right now. We'll start a list. This is Whiskey Bravo 5 Delta. Yeah, now you guys are making me feel foolish, since I'm the only one here who didn't know better. It seemed to have picked up an infection from handling food improperly. You might say that I learned from the school of hard knocks. And we heard already from cases that have been clinically treated and some of those medical considerations. Again, you all have private physicians of your own. That's who you really need to talk about these issues with if you feel that you're prone because of a medical consideration. We're not offering medical advice, and we're just having a group of discussions amongst hams. Amateur radio operators have a common passion of medical care and medical science. But at the end of the day, it's your personal relationship with your medical team where all these questions should be answered. Hopefully, we've enlightened you to being able to ask intelligent questions, because when you can research and offer information on your own and be an engaged patient or a consumer, that's when you're going to find more receptive and interactive help from your medical team. Do we have any additional suggestions or comments? Go ahead and let me know. I think we'll start with N5RTF. Chip.
Yeah, this is N5RT. Yeah, for the people on the air, go over again in verbally how to thaw a turkey.
There are three ways that to thaw a turkey. One way was in the refrigerator. And of course, the instructions are on the turkeys how many days it should be done. Now, if you do decide to thaw one in the sink, I think that's also possible, but the bag needs to be sealed. You don't want to contaminate everything around you. There's also, according to the research earlier in the presentation here, you can thaw one properly in a microwave as well. Chip, are you aware of any other ways? I mean, I assume that when you cook one in peanut oil, Cajun style, you don't do it from a frozen bird, and you practice displacing the volume of liquid in the turkey fryer so that you don't cause a fire through overflow and burn down your house. I mean, I've had friends and patients make Cajun turkeys for me. And you might give a Cajun perspective to the subject anyway.
I definitely fried turkeys. The real key to that is to clean them out well inside. You're not going to stuff a turkey and then fry it. It's going to be hollow inside. You make sure that all the wrappings and packages and strings and everything that they put inside one has been removed before you. The other thing is it takes a lot of grease. It takes a hot fire. It's best done outdoors. And I always used a rope and a pulley so that I would lift the bird up from a distance, generally 5 to 8 feet away. And of course, you don't drop it in the grease. You gently lower it, but it does splatter, and that causes mistakes and can compound if you're not careful. Also, when you want to remove it, it splatters. So I always just used, wherever I lived, I put a pulley into the ceiling above the patio or wherever I was working, and just used a nylon rope and some wire for the last few feet. And it worked very, very well. And so you're getting me hungry now. Getting back on to it.
Thank you, Chip. It's always nice to have a Cajun perspective in 5RTM. This is Whiskey Bravo 5 Delta, the Medical Amateur Radio Council, Grand Rounds in the Air, and that which is also a Zoom session here today. And, Chip, I'm coming to see you in December. So I want it gives us something else to do. You can show me in person how to fry a turkey when we're not in the back getting crabs out of the crab trap. I assume that you always defrosted your turkeys ahead of time because you're not going to mix water in the oil. But in addition, any good Cajun knows they've got to properly infuse the turkey with the appropriate seasonings and spices before they fry it, especially if you like it a little on the hot side. And I'm not a Cajun. I'm just relaying what I've had made for me by patients and friends. Did you have a comment about that, Chip, and 5RTF?
Yeah, it does have to be thawed. It does have to be a reasonable size. I forget how many minutes per pound, but it's better if you go with about an 8-pound bird or something. You don't want to do a 20-pound turkey in a fryer, or you won't get it done all the way through. There's also an interesting thing called a turducken in Cajun country, in which they have a turkey stuffed with a duck, stuffed with a hen, stuffed with stuffing, and it's cooked for hours and hours and hours in an oven, and they're absolutely delicious. But it looks like a highway accident where everybody's been rear-ended. In 5RTF.
Oh boy, now we're really talking. You see, it's so interesting to be here for the net. Now, also, if they have a vegetarian version, you'd have tofu turkey, whatever they call that, with synthetic one stuff before they took it for cake. But can you be a Cajun and be a vegetarian? I don't know if those are exclusive of each other. But Chip has just created a problem for himself. You may not be aware of it, but the problem that Chip created is that in the first quarter of 2025, we will have a grand round sessions on Cajun cuisine and its medical impact. So Chip, thank you for volunteering to do that ahead of time, giving us a preview of the enjoyment that we're going to have next year when we discuss that subject. Two of the best presentations we had many great presentations, but two very fun presentations this quarter during the Grand Rounds of the Year. Chip had led. Those are available. By the way, we have a YouTube channel, Healthcare Hams. So just look up Healthcare Hams, go to YouTube, look up Healthcare Hams, and look at our video channel. You see we've produced videos for the general public using our Grand Rounds on the Internet as the source of the material, and as well as our Zoom sessions. I think you'll find that fascinating. Now, we are the Medical Amateur Radio Council, our ARL, American Radio Relay League associated, affiliated club, and we even offer scholarships through them, through their foundation for students. So we do try to participate in any way that we can to assist with our particular areas of interest and bring it to the general amateur community. Are there any additional questions or suggestions Again, this is Whiskey Bravo 5 Delta. Please direct those questions or suggestions to me, JAA45. Go ahead.
Well, I think we need to have separate do one on beignets. So I definitely think beignets are right up on the category. Over.
Okay, we have WB9EDP requesting a grand round session on beignets. I think that there could be some medical implications. I mean, my daughter was in New Orleans at Cafe Du Monde and ran into Steven Tyler. And look at Steven Tyler's physical appearance. So it's possible beignets could have contributed to the problems he's having, but I'm not going to diagnose that. So yeah, I think we can fit that into New Orleans cuisine under Cajun, even though it may not necessarily be Cajun. Thank you for the suggestion, Harry, and the jovial intent that it was offered. I think it was jovial, but we can certainly make it a serious topic. Again, we are a very interesting group of amateur radio operators. For those of you that aren't amateur radio operators, and if you go to one of our ham meetings, a big convention, and walk around and see, you'll see the most interesting of people walking around with all sorts of clothing. Sometimes they're wearing hats with towers on top. And if you combine that with amateur radio operators that are medical doctors and their own individual idiosyncrasies, we get super interesting people that are always worth talking to. We appreciate you all being here with us today. That's the jovial side of our net today for the general amateur community. Any other comments or suggestions? Make your call. Okay, nothing else being heard. I'm going to just a last minute check for any late check-ins. Make your call. Okay, nothing heard on the shortwave end. Well, thank you for everybody being here with us today. And check out our websites, healthcarehams.org. If you have a particular email question, you can direct it through the links on the particular website or nets@marco-ltd.org. That's nets@marco-ltd.org. Or just Google us, the Medical Amateur Radio Council. You'll find our information. We do our net every Sunday at this time, 11 Eastern, and we do appreciate everybody being here with us. And if you're interested in our organization, I'm the secretary. Feel free to also contact me through the links on the net. That being said, I'm going to go ahead and bring the net to a close. Thank you for being us with here today. And